1. What is the primary responsibility of a CHSP when developing a healthcare safety training program? A. Focusing exclusively on OSHA regulations. B. Ensuring compliance with regulatory standards while incorporating adult learning principles. C. Minimizing training time to reduce operational costs. D. Teaching only advanced safety management techniques. 2. According to adult learning theory, which approach is most effective when training healthcare safety staff? A. Lecture-only instruction without interaction. B. Connecting new safety concepts to participants' real-world healthcare experiences. C. Using identical methods as undergraduate education. D. Avoiding practical applications to focus on theory 3. When mentoring a new safety officer in a healthcare facility, what is the most effective strategy? A. Providing answers without detailed explanations. B. Demonstrating safety assessments while explaining regulatory requirements and risk analysis. C. Allowing complete independence without guidance. D. Focusing only on documentation without field observation. 4. Under OSHA's bloodborne pathogen standard, 29 CFR 1910.1030, what is required before an employee begins tasks with potential exposure? A. Annual physical examination. B. Training on exposure control plan, PPE use, and post-exposure procedures. C. Written exam only. D. Hepatitis B vaccination completion. 5. What is the hierarchy of controls in order from most to least effective? A. PPE, engineering controls, administrative controls, elimination. B. Elimination, substitution, engineering controls, administrative controls, PPE. C. Administrative controls, PPE, engineering controls, elimination. D. Engineering controls, elimination, PPE, administrative controls. 6. When evaluating the effectiveness of a safety training program, which assessment method provides the most comprehensive data? A. Written test scores only. B. Multi-level evaluation, including knowledge tests, behavior observation, and outcome metrics. C. Participant satisfaction surveys alone. D. Attendance records. 7. What is the permissible exposure limit (PEL) for formaldehyde established by OSHA? A. 0.5 ppm. B. 0.75 ev. 2 ppm STEL. C. 1.0 ppa. D. 2.05 ppm STEL. 8. Which communication technique is most effective when presenting safety data to hospital administrators? A. Using technical jargon exclusively. B. Presenting data with clear metrics, cost-benefit analysis, and actionable recommendations. C. Providing raw data without interpretation. D. Focusing only on compliance penalties. 9. What is the primary purpose of a job safety analysis JSA in healthcare settings? A. To document employee performance issues. B. To identify hazards associated with specific tasks and develop controls. C. To fulfill insurance requirements only. D. To replace incident investigations. 10. When developing a curriculum for healthcare safety professionals, which component is essential? A. Learning objectives, competency assessments, regulatory updates, and practical applications. B. Theoretical knowledge only. C. Historical safety information exclusively. D. Generic workplace safety without healthcare specifics. 11. Under the Joint Commission standards, how often must hospital emergency management plans be tested? Monthly. B. Twice annually through drills or exercises. Annually only. D. Every 3 years. 12. Which mentoring approach best supports professional development of safety staff? A. Annual performance reviews only. B. Regular coaching sessions with goal setting, feedback, and skill development opportunities. C. Criticism without constructive guidance. D. Hands-off approach with no interaction. 13. What is the required frequency for fire drills in healthcare facilities under NFPA 101 Life Safety Code? A. Monthly in all areas. B. Quarterly on each shift. C. Annually per building. D. Semi-annually facility-wide. 14. When creating formative assessments for safety training, what is the primary objective? A. Assigning final certification grades. B. Providing ongoing feedback to identify learning gaps and improve understanding. C. Ranking participants against peers. D. Meeting documentation requirements only. 15. What does the National Fire Protection Association NFPA 99 standard address? A. Building construction codes. B. Healthcare facilities code, including medical gas systems and electrical safety. C. Fire extinguisher maintenance only. D. Emergency vehicle operations. 16. Which conflict resolution strategy is most appropriate when staff disputes a safety violation citation? A. Dismissing concerns without discussion. B. Active listening, reviewing evidence objectively and explaining regulatory basis. C. Immediate disciplinary action without investigation. D. Ignoring the issue to avoid confrontation. 17. What is the minimum illumination level required for general hospital corridors under OSHA standards? A. 5-foot candles. B. 10-foot candles. C. 20-foot candles. D. 50-foot candles. 18. When teaching incident investigation techniques, which instructional method is most effective? A. Lecture only without examples. B. Case study analysis with hands-on practice and root cause analysis exercises. C. Reading accident reports independently. D. Written exams without practical application. 19. What is the maximum allowable concentration of nitrous oxide in dental operatories according to NIOSH? TP. B. 20. C. 50 ppm. D. 100 ppm. 20. Which assessment tool is most effective for evaluating competency in conducting safety audits? A. Multiple choice test only. B. Direct observation using a competency checklist during actual audit performance. C. Self-assessment without verification. D. Written case study exclusively. 21. Under OSHA's hazard communication standard, what must be readily accessible to employees? A. Safety equipment only. B. Safety data sheets, SDS, for all hazardous chemicals used in the workplace. Emergency contact list only. D. Building blueprints. 22. What is the fundamental principle of adult learning theory and andragogy most relevant to safety training? A. Adults prefer passive learning environments. B. Adults are self-directed and learn best when content is immediately applicable. C. Adults learn identically to children. D. Adults require extensive supervision during learning. 23. When developing a respiratory protection program, what is required under OSHA 29 CFR 1910.134? A. Annual equipment inspection only. B. Medical evaluation, fit testing training, and written program. C. Mask distribution without assessment. D. Voluntary participation only. 24. Which teaching strategy best accommodates diverse learning styles in safety education? A. Lecture-only format for all sessions. B. Varied methods including visual aids, hands-on demonstrations, and interactive discussions. C. Reading assignments exclusively. D. One approach for all learners. 25. What is the minimum aisle width required for emergency egress in healthcare facilities? A. 24 inches. 36 inches. C. 44 inches. D. 48 inches. 26. When conducting performance evaluations for safety staff, what documentation is essential? A. Verbal feedback only. B. Written records with specific observations, competencies achieved, and improvement areas. C. General impressions without details. D. Peer gossip and rumors. 27. What is the purpose of OSHA's Voluntary Protection Program, VPP? A. Mandatory participation for all facilities. B. Recognition of work sites with exemplary safety and health management systems. C. Penalty reduction program only. D. Insurance premium discount program. 28. Which mentoring technique best develops critical thinking in safety professionals? A. Providing solutions without explanation. B. Asking guided questions that promote analysis and problem solving. C. Memorization of regulations only. Avoiding complex scenarios. 29. What is the required minimum distance for electrical panel clearances in healthcare facilities? A. 12 inches. B. 24 inches. C. 36 inches width, 30 inches depth. D. 48 inches, all directions. 30. When teaching regulatory compliance, which approach promotes deeper understanding? A. Memorizing regulation numbers only. B. Explaining the intent and rationale behind regulations with real-world applications. C. Reading regulation text without discussion. D. Focusing on penalties exclusively. 31. What is the CDC's recommended hand hygiene compliance rate target for healthcare facilities? A. 75%. B. 85%. C. 95% or higher. D. 100% mandatory. 32. Which evaluation method provides the best measure of training transfer to the workplace? A. End-of-course test scores. B. Post-training observation of behavior change and performance metrics. C. Attendance records. D. Participant feedback forms. 33. Under OSHA's Emergency Action Plan standard, what is required for facilities with more than 10 employees? A. Verbal communication plan only. B. Written emergency action plan with evacuation procedures and emergency contacts. C. Fire extinguisher training exclusively. D. Annual emergency drill without documentation.